Hi guys, today we are talking about cystitis, UTI, created by Chada, Vanessa, Harjat, and Virginia. What is cystitis? Cystitis is an inflammation in the bladder known as urinary tract infection. Cystitis is the inflammation of the bladder which have the urethra connected to the bladder with the ureters up to the kidneys. Women have shorter urethra than men, which makes women 10 times more prominent for bacteria to travel to the bladder. Common symptoms can be mild and resolve on its own. Frequency needing to pass urine more often, having sudden urges to pass urine, burning sensation when peeing, pressure or pain in the lower tummy, and cloudy and strong smelling urine. Also, blood in the urine can be present. Causes of cystitis are medications, particularly the chemotherapy drugs, radiation treatment of the pelvic area, long-term use of a urinary catheter, sensitive to certain products such as feminine hygiene sprays, spermicidal jellies, or lotions, conditions including diabetes mellitus, kidney stones, or enlarged prostate, sexually active, holding a full bladder, holding the need to pee for a long period of time, and wiping from the back to the front, introducing E. coli to the urethra. The most frequent cause of acute cystitis is an infection of the bladder caused by the bacterium E. coli. Bacteria that causes UTIs typically enter the urethra and then travel up to the bladder. Once in the bladder, the bacteria stick to the bladder wall and multiply. This leads to the inflammation of the tissue lining the bladder. The infection can also spread to the urethra and the kidneys.
Predisposing risk factors for urinary tract infection include being a female due to the close proximity of the urethra to the anus, where bacteria-infested stool resides, which can travel up the urethra, therefore placing women at a greater risk of developing a UTI. Also being a male, due to males' prostates naturally growing with age, which then causes obstruction of urine, therefore developing a UTI. Then we have diabetes mellitus. Patients that are diabetic are prone to develop a UTI due to the frequent urination and their elevated blood sugar levels, which give bacteria a desired environment for growth. And we have menopause. As estrogen production declines, UTIs develop more frequently. And then we have pregnancy. It increases the risk for bacteria growth due to the compression of the ureters due to the woman's pregnant uterus, causing a stop to the urine flow, therefore causing a UTI. Finally, we have kidney stones. They can block the urinary tract so urine collects in the kidneys, thus creating an environment for bacteria to cause infection. Risk factors according to gender. For men, there's enlarged prostate glands, which we spoke about in a previous slide, which grows naturally with age. Being uncircumcised, which is an area for bacteria to grow if not cleaned properly. Sexual intercourse. Sexual intercourse is not the cause of UTI. It's the motions in which occur that can spread bacteria to the urethra, which causes a UTI, as well as age, like we spoke about in the previous slide, inadequate fluid intake, kidney stones, as well as diabetes mellitus. For women, the urethra is short in length versus men. For women, it's 1 to 2 inches long versus men, it's 7 to 8 inches long. For women, there's also pregnancy, sexual intercourse as well, contraceptives, age, inadequate fluid intake, as well as kidney stones and diabetes mellitus. Other risk factors like catheterization. For example, an indwelling urinary catheter can cause a UTI the longer it is used. A previous UTI. A history of UTI places one at risk for reoccurrences. There's also poor hygiene. This gives bacteria an ideal environment for growth, which we all know bacteria is what causes UTIs. Not urinating when needed. Holding in one's urine places people of all ages at risk for UTI because it collects in the kidneys, therefore collecting that bacteria, therefore causing a UTI. And lastly, bubble baths. For bubble baths, one uses soaps, which have harsh chemicals that irritate the urethra, which then causes painful urination. So once people experience this symptom, they withhold the urine, therefore causing urinary retention, thus a UTI. If a urinary tract infection is left untreated, it may very well lead to a more serious complication or chronic infection such as pyelonephritis, which is a urinary tract infection that usually starts in the urethra or bladder, then it makes its way to one or both kidneys. There's also systemic sepsis, which when bacteria enters the bloodstream causing infection, it may damage vital organ systems in the process. Then we have septic shock, a life-threatening condition which one's blood pressure drops to a significantly low level after an infection. And if infection finds its way to the kidneys, it may very well lead to acute renal failure, which is the sudden loss of kidney function and can also be treated and reversed. It could also lead to chronic renal failure, which this is decreased kidney function occurring over a long period of time and is not able to be reversed. It can only be managed.
It is important to drink plenty of liquids, especially water, if you want to prevent a urinary tract infection. And that's to help your body eliminate any bacteria that is within your urinary tract. It may also be useful to avoid foods high in acidic content, such as citrus, tomatoes, caffeinated drinks, alcohol, and cranberry juice. Studies demonstrate that there is a slight benefit to using cranberry juice, but larger studies found no significant benefits of drinking cranberry juice. Also, if you are taking medication such as Coumadin, cranberry juice should not be taken with that. And if you are a diabetic, which is a risk factor of UTI, cranberry juice can increase your sugar levels. So it's best to avoid cranberry juice. Wearing 100% cotton undergarments may also be useful. The cotton material absorbs moisture and helps keep that moisture away from your body. Washing undergarments separately in hot water may also help, as the hot water can kill the bacteria. Also, it's important that you urinate frequently if you're experiencing UTIs. So, like I said, keeping yourself hydrated and urinating frequently goes hand in hand. You're helping your body eliminate the bacteria. If you have the urge to urinate and you choose not to use the restroom, then you're allowing that bacteria to sit in your bladder. For females, it's important that you wipe from front to back after having a bowel movement, and that's to avoid bringing any feces from the anus into your vagina, creating a big problem with bacteria. It may also be useful to take showers rather than baths, as bathtubs contain many bacteria in them. If you must take a bath, it is important that you properly sanitize and disinfect the bathtub prior to sitting in it. If you don't wash the bathtub out properly or disinfect it properly and get rid of the bacteria that are sitting in it, you will introduce the bacteria into your vagina and create a bigger problem. Other factors to consider are to avoid deodorizers. Any fragrance or perfumes that go into the area can irritate the skin and can lead to an infection. Here are some treatments. I'm starting off with home remedies, since in the San Joaquin County there is a great population that have no access to health care. Those who have no access to health care usually turn to home remedies. It is important that you know that if you believe you have a urinary tract infection, that you stay hydrated by drinking plenty of water every single day. This will help your body eliminate the bacteria within your urinary tract. It is important that you stay clean and dry, even if it means changing your undergarments more than once. You can use a heating pad also on your lower abdomen to help soothe the pain and pressure of having a UTI. Lastly, you can take a sitz bath, making sure that you properly disinfect your bathtub prior to sitting in it. You can sit in your sitz bath for 15 to 20 minutes in warm water. If you have access to Epsom salt may be helpful to include in your sitz bath because of its antiseptic properties. Persistent infections should be discussed with your provider. Antibiotic treatment may be necessary and is the first-line treatment for an infection if it's caused by a bacteria. The length of the antibiotic treatment depends on the severity of the infection. For postmenopausal women, it is important that they specifically speak to their provider and explore medication options to help their urinary tract infection due to their altered hormone levels. Lastly, for men, infections are rare, but if a man believes they have a urinary tract infection, it is important that they also contact their provider to determine the underlying cause. Usually, if the cause is bacterial, antibiotics are also the first line of treatment. Men should especially contact their provider for treatment options if their partner has been diagnosed with an infection and they believe that they also have an infection.
Hi, my name is Harjot. There are several resources that are available to the community in San Joaquin County for cystitis. One of them is Community Medical Center. CareLink. They provide primary medical and behavioral health care services at local shelters, treatment programs, and homeless services. I listed several locations that could be found in Stockton. There are many more that are in Lodi, Manteca, Tracy as well. There is also, along with community medical centers, there are also local hospitals. There is St. Joseph's Medical Center, and then there's Lodi Memorial Hospital. St. Joseph's Medical Center, they provide a great service, and they have a website that actually allows a person to know what signs and symptoms to look out for, as well as using their online tool to find a doctor. Along with St. Joseph's Medical Center, there is also Adventist Health Lodi Memorial Hospital. The address is provided on the slide, as well as there's a link that will direct the page to Lodi Memorial Services. They also have an online tool to find a doctor. And along with that, there are also local homeless shelters. Their use of clean water is a preventative measure, and utilizing these shelters will help with that. There are two homeless shelters I have listed, but there are several more in Stockton. There are many more all over San Joaquin County, and it's really important to use this because clean water is really important to prevent cystitis. And there is also Public Health Services of San Joaquin County, which work to promote, protect, and improve health. Healthy People 2020 is a federally funded program that works to aim and hit different targets for the United States. The common goal of Healthy People 2020 is to decrease the number of UTIs by taking preventable measures. Every 10 years, there are new goals that are listed to improve health, focusing on decreasing the numbers of new cases. UTIs are the second most common type of infection that is found in older patients. There are preventable measures such as wiping from front to back, washing hands before and after using the restroom. And there is more information on the healthypeople.gov website, which raises more awareness as well as shows more preventable measures on UTIs.